I will make it exciting. So as Mark mentioned, really casual here. So if you have questions, please stop me at any time. I know Mark will be checking out the chat box, so you could put your question in there, or even just stop me at any time. So at this point, I'm just going to press record, and hopefully I don't say anything too offensive. Just kidding. Really, we're here to talk about brain health. It's a really important topic as more and more research is coming out, and as we are an aging population, everyone is beginning to be a little bit more concerned about how they can be a little bit more brain healthy. I'm going to go through the presentation and what we will cover. Yeah, so let's start with why we want to talk about brain health. So why did Mark and his team reach out to the Dementia Society for this presentation? Well, really just to talk about brain health. And the brain really does important work. It is our quote unquote our CEO of our body. It allows us to make sense of the world that we live in. It is responsible for our emotions, our movements, our sensations, and it really does a lot of work. There's so much research out there on how we could take care of our body, but really we're trying to put a focus more now on how we can take care of our brain. When we look at our brain, it is only 2% of our body weight, but it takes up around 20% of the oxygen that we breathe in. And what we're going to talk about as well is how to be brain healthy, and then we're going to get into a little bit about dementia and how that differs from normal aging. And finally, we're just going to talk a little bit about the caregiver experience. So if you are supporting someone living with dementia, what resources are out there, what's important for you to consider, and how the Dementia Society is a valuable resource. So as I mentioned, we're going to talk about the aging brain. We're going to go over some brain healthy choices. There are 8 of them, and I believe you all have a handout as well that talks about the 10 warning signs and 8 ways to be brain healthy. So you could follow along with that. And then finally, we'll talk about dementia and support for caregivers. So I'm doing a little bit of repetition here as, oh, hi, Ian.
Hi. Just took me a minute to get signed on.
No worries. A little bit of repetition here. So I started to talk about our aging brain. So our brain does age like the rest of our body. So just like I can't do as many push-ups as I could in my teens, as I age, my brain does get a little bit slower in terms of memory, thinking speed, and concentration. As we age, though, we gain our life experiences, and this is how what we're building up is our cognitive reserve. And I'm sure those of you who are participating have heard this before, but if you haven't, research is talking about how our brain is plastic in terms of we're able to build new connections between brain cells, and this is allowing allows us to learn new skills and adapt as we age. But as we age, there is some memory, concentration, and thinking speeds decline across the population. So I'm just moving my screen around. So here we go. The important thing here. So we're going to go over 8 ways to be brain healthy, and all 8 of these are not, there is nothing new, or I don't think there's anything new here, but it will be a good reminder on how to be brain healthy. And my slides are a little bit mixed up here. I apologize for that, because it says 7 ways to be brain healthy.
Okay. I did.
I'm just going to pause this for a second. I think I opened the wrong slide. I'm very sorry. Is there anyone who has a joke right now while I grab the next slide?
Jess, you're always good for jokes.
Here we go.
I don't think I'm allowed to make any more jokes. My last one wasn't funny. I think that's been taken off the table.
Okay. Ta-da. Here we come. There we go. I'm very sorry. That's embarrassing. But that's okay. Just have to move the screen. Here we go.
It can be said that you were challenging your brain.
Yes, that's right. Well, I wanted to give you the most up-to-date version here, because the one I was going to present has 7 ways to be brain healthy, and I think everyone here deserves to know the 8 ways, so that we can stay ahead of the game here. Okay, I'm back on my feet. So we're going to go over these 8 ways to be brain healthy. The first one, nothing new here, but it's really to take care of your heart. An unhealthy heart is an unhealthy brain. I think if you could remember anything that I say for this slide, is that an unhealthy heart is an unhealthy brain. So it's really important to have regular health checks with your physician, to know your numbers in terms of blood pressure, cholesterol, blood sugar, and to maintain a healthy weight. When we look at the risk factors for dementia, we have diabetes is a significant risk factor. Having high cholesterol is a risk factor. Blood pressure is also a risk factor, but it's looking at it in terms of what we call vascular dementia, and you have a higher risk for having a stroke. And vascular dementia is either having a large significant stroke or many small strokes. So it's really important to have regular checkups with your physician to know your blood pressure, cholesterol, and your blood sugar. Really, again, nothing new here, but smoking cessation. It's important. We know the harms of smoking, and so in order to take care of our heart, really encouraging smoking cessation, and to limit alcohol. So to summarize here, I would say what's good for your heart is good for your brain. As we go through the next 7 ways to be brain healthy, they all kind of interrelate together. But here, again, what I would highly encourage you to remember is what's good for your heart is good for your brain. To be active. It's really important here. Our bodies are meant to move. I think that is the one thing that I said to all of the patients that I saw in the hospital when I worked there. We need to keep moving. Our bodies are meant to move. So research is suggesting that everyone aims for around 30 minutes of activity most days. If we look at specific research, it's encouraging 150 minutes of physical activity a week, and this is associated with better cognition and decrease risk of developing dementia. So really encouraging to move more, sit less. I think that when we look at our office life here, the new cause I've heard recently is that we sit way, the new thing that I hear is that we sit way too much. So I think if we're all in the comfort of our home here, I would say if you have the ability to stand over the next 45 minutes, by all means, please stand. But when we talk about being active, if you haven't led a consistent active life and you're wanting to start something new, again, it's really important to go to your family doctor to talk to them about if there's any risks of starting a certain exercise regime or program, just to be safe. Recently, I did this presentation with Dr. Andrew Frank from Briere Memory Program, and the one fact that stood out to me when he talked about physical activity and dementia is that it's really, research is coming out that it's as simple as a moderate brisk walk for 30 minutes a day. Like that's a moderate walk has shown results that it can really help be associated with better cognition and decreased chances of dementia. So it's as simple as a moderate walk most days. Is there a question there?
Yeah, sure. I mean,
Sure.
any favoring sort of more aerobic heart rate exercise over strength exercise, or what? Yeah, are your thoughts on what?
So no, it's a great question, Mark. So what I would say is that it's important to get your heart rate up so that there's more blood pumped to your brain. So the more of the research is associated with aerobic exercise. So it would be anything from walking or swimming or an exercise class or whatnot. There's less research out there on the benefits of strength exercise, balance, or flexibility. However, they are very important for a number of other reasons. So you want to maintain your strength so that you can maintain your function, so that you can continue to do your activities of daily living. Strengthening exercise is also associated with decreased risk of diabetes, which is a risk factor for dementia. Balance and flexibility exercises, again, it's important so that you can maintain your function and your independence. So it all has its benefits, although it's more aerobic exercise that is associated with the benefits of for dementia. So the next, number 3, the next way to be brain healthy is to eat healthy. Again, nothing new here. And I don't know if participants here have seen Canada's new food guide, but it is a wonderful presentation and advice and evidence base on how to eat healthy. Really encouraging plenty of vegetables and fruits. Getting your proteins from more than just red meat. Looking at fish, whole chicken, legumes, eating whole grains. And I think the really important one here is having water as your drink of choice. So I would encourage you, if you haven't, to look up Canada's food guide, and you could really use this as your a guide to follow. There's lots of research out there that I'm sure in your mind you've heard about the Mediterranean diet. And the Mediterranean diet is there is some evidence with that is associated with lower levels of stroke, diabetes, cardiovascular disease, and death of any cause. And the Mediterranean diet is, again, it's focused on fruits, vegetables, legumes, and moderate consumption of oily fish, dairy. There's low consumption of meat, sugars, and fat. And just as a little bit of a joke here, Jess, I do have some jokes here, but in researching this, we did come across some very interesting tips on how to eat healthy. So I'm just going to read it off. It was from an article, but don't eat things that would eventually not rot. Avoid food that is advertised on television. Don't buy food that can be served through the window of your car. When grocery shopping, really encouraging to stick to the outside of the grocery store, where all the fresh fruit, vegetables, and dairy and meat are.
Ironically enough, the outside of the grocery store is also where they stock my favorite ice cream.
There you go.
I'm just joking.
To eat meals with people you love, and I think this one is really important, and it is related to one of the next ways to be brain healthy and being social. To cook your own meals, again, really important. To do less of a takeout or dining out, and focus on cooking your own healthy meals. Perfect. It's almost like it was meant to be. So the next way to be brain healthy is really encouraging to be social. Just as we're meant to move, our bodies are meant to move, as human beings, we're meant to be social. We're meant to connect with people. So as we age, encouraging that we continue to participate in social activities. So whether that's joining a club, a recreational activity, so you could put the being physically active and social engagement in the same, and cross that off your list by joining a choir or learning a new activity. It's important to catch up with family and friends, or volunteer with your community. But one of the really big risk factors for those living with dementia and their caregivers is social isolation. We tend to isolate ourselves, and there is research out there that it is a risk factor for dementia. So just because we retire doesn't mean we can go off and not talk to anyone for the rest of our life. Really, it's important to stay engaged, to stay social, and to be part of our community.
Dean,
Yes.
on that, as you said, it's very difficult for people who are caring for people with dementia to get out. Often they feel uncomfortable, or they don't know where to go. Do you have any advice on how to actually make that step to get out to be social?
No, that's a great question, Helen. And so I think it's a great plug here for something that the Dementia Society is doing, and as we are going around Ottawa and Renfrew County and looking to inform the community on how to be dementia friendly. So really educating the population, community, businesses, on how to engage with people living with dementia, how to create a supportive environment, and because it's really what we need to do is to change our environment so that those living with dementia can still be meaningful participants.
That's great.
On a side note, it is, I think it is more, the way that we can reduce the stigma is just to keep informing our family and our friends, and how we could be supportive. We do at the Dementia Society have an exercise program for caregivers and persons living with dementia. We do have a music program, again, for caregivers and persons living with dementia. But also there are many community support agencies, whether that's an adult day program. There are specific caregiver support groups. There's really lots of opportunities, and I don't think you have to focus on, you don't have to limit yourself to the ones that are dementia specific. Helen, that was kind of a ramble of an answer, but I hope, did I answer your question? Oh. I'll take the silence as a yes.
Yeah, when you work with her long enough, you learn to.
Okay. The next way to be brain healthy is to challenge your brain. So I'd say put up your hand if you do this thing, if every day you do the crossword puzzle or Sudoku. But I can't see anyone put up their hand. There we go, Ian. Thanks, Ian.
Wish I had time. Besides, it's too challenging for me.
Yeah, so it's really it's encouraging lifelong learning. But really, it's exposing our brain to new things. So doing the brain games or brain challenging games like Sudoku, or there's lots of new technology coming out that you can download on your phone, or you can participate on your computer, is really great. My encouragement, though, is to not just focus on one thing and have that as your only way to challenge your brain. It would be like if I was only working out, doing bicep curls at the gym. That is the only muscle that I'm going to grow. So really looking at, if it's memory, or if it's executive functioning that you're working on, maybe there's other opportunities to looking at visual spatial skills or coordination. So really just trying a whole range of activities to challenge yourself. And if you really want to take it to the next level, it's learning a new skill. So whether it's an instrument, or writing a poem, or a song, or learning how to dance, or a new language. It's learning a whole new skill altogether. That is when you're really challenging your brain.
Dean, you raised the point about the electronics for brain games and stuff.
Yes.
Lumosity is a great option because it has all those crossword puzzles and brain teasers and different concepts for that stuff. And it's a mobile app or website that you can download, and it's free to use. So that's a good option as well for our viewers out there that might want to learn a little bit more about that.
There is certainly that is one option, and there's certainly many of them out there. Before, when we start to go to the draw or the poll, I'll run over to my notes, as I was just with one physician from Briere who I wrote down his top recommendation as best on the market out there right now. So I'll look that up. But it's also looking at it from the perspective, if you're a social person, look for things that you could challenge your brain socially with other people. Or if you're, if you like to do things independently, then maybe the computer games are more your way. to challenge your brain. So it's looking at what fits your lifestyle the best. Protect your head. So really important here. I don't. There's been so much research coming out of. You've probably seen it on the news, but from the football industry, from hockey, about concussions and the increased risk of dementia. So if you are, we're encouraging you to engage in physical activity, but also it's important to protect your head. So if you are biking, wear your helmet. I mean, I think this is almost automatic for everyone now, but wear your seatbelt. Looking at how you can reduce your risk of falls, especially with the winter that we just had in Ottawa and with all the ice. So really protecting your head. It's actually surprising. I did bike last weekend on one of the streets in Ottawa that they close on Sundays for everyone to bike or rollerblade or whatnot. And it surprised me quite, about a quarter of the people still didn't wear a helmet. It's really, really important. Okay, number 7 is sleep well. More and more research is coming out on the importance of sleep. So encouraging 7 to 8 hours of sleep in a 24-hour period. Yes, the recommendation is try to get it in a continuous amount of time, but as we age, it becomes more difficult for some people to sleep. So you can build that up in terms of having naps or non-continuous sleep, but looking for a total of 7 to 8 hours in a 24-hour period. And how you do that, if you do struggle with getting to sleep, it's important to focus on what we call your sleep hygiene or your sleep routine. So if you do like to go to bed at 9 p.m., after this webinar is over, close your phone or close your computer and not be exposed to blue light from your cell phone or your computer or the TV. To do something relaxing before bed, to open a book or meditate or whatnot. So to try various relaxation techniques. We talked about it before, but physical activity. If you've engaged in physical activity earlier on in that day, it does. Research shows that it does really help promote better sleep patterns. And again, talking about the winter that we just had, but a beautiful day like today is you wouldn't think twice about it, but to expose yourself to light during the day really does help to maintain your circadian rhythm and to promote a healthy sleep routine. And I'm not an expert here, but there is research showing that when we look at Alzheimer's disease and where the plaques and different proteins build up, the research has shown that they do build up in an area that helps us promote sleep. And so the less sleep that we have, the more proteins that build up. It's almost like a negative spiral in terms of Alzheimer's disease. So really promoting a healthy sleep routine and to try to get 7 to 8 hours of sleep.
Yeah, thanks. Yeah, very key, something I sort of wish would have more of. Is there any research that you're aware of that is it more important to sort of keep the circadian rhythm the same, such as some days you're getting up maybe at 6 in the morning and then you're on weekends you're sleeping until 9 or 10? Is that detrimental? Whereas if you could sort of pick at 8 o'clock wake up time every time, continuous bedtime, same time every time, then total hours. I don't know.
Well, That's a great question, Mark. And again, not an expert. So if you are struggling with your sleep, I would encourage you to go to your family physician. But I do know that a part of the sleep hygiene or sleep routine, it is going to bed and waking up at the same time every day of the week. So um, it does kind of mess with your patterns if you're sleeping until 11 a.m. on the weekends, but waking up at 5:30 a.m. Monday through Friday. So yes, it is recommended that you do try to focus on going to bed and waking up at the same time, no matter what day. Harder said than done. Okay, and the very last way to be brain healthy is really we've seen this in the news, in social media over the past couple of years, but really there's a huge focus on caring for your mental health. So it's all a part, all part of taking care of yourself. So you know there is some research that does associate depression with a higher risk of developing dementia. Um, but that being said, in order to be overall brain healthy, you really do have to take care of yourself and figure out ways how to build resilience. And we'll talk about it in the next few slides when we focus more on the caregiver perspective, but looking at how you can build resilience through physical activity, through social engagement, through spiritual resilience. But it really encouraging everyone to take care of their mental health. And as I said at the beginning, all of these ways to be brain healthy do intertwine. And you could kind of check the physical activity box and social engagement box if you're part of a group, and then that's really healthy for your mental health. And then eating healthy and sleeping well, it's all intertwined, but it's really important to take care of your mental health. I don't think there's anything new here from that perspective. So just to continue on, we covered 8 ways to be brain healthy. They're all very important. I wouldn't say one's more important than the other. And you may be asking yourself, where do I start? And so you could start with something very simple and create a very focus on either one of them and create a small goal for yourself, or you could try to make a goal for all of them. Or as I'd mentioned, you could look at incorporating physical activity and being social. And you could also include protecting your head by, if you're engaging in physical activity, you're wearing a helmet while you're riding a bike. Really, though, is with anything, you want to pick a healthy choice to work on, and you want to make a goal. And when it comes to goals, making it specific, realistic, attainable, and measurable. So, sorry about that. This is a repeat of a slide here. I'm not having PowerPoint luck today, but I think it's just a good way to summarize that our brain does age like the rest of our body, and that it in terms of in terms of working on the 8 ways to be brain healthy, I would say it's never too early or too late to start. So whether you know someone or a family that is in their teens, or if you know someone who's 95, it's never too early or too late to focus on how you can be brain healthy. And so I would say, if you could take away anything from that, again, it's just really important to get started.
And I just want to encourage everybody, actually. I know I've spoken to some of you on the line, and this is your first time using Zoom. So you've actually done that already by joining this webinar and done something new and adapted. So congratulations for trying and achieving, and you're already putting into practice what Dean's saying.
It's so true. I think there is a nervous thing with technology, and that some people don't think they can figure it out, but all you have to do is try. Just like for physical activity, I say the hardest part is putting on your shoes. After that, it's pretty easy. You just have to make the decision. So we're going to take a little bit of a transition and start to talk about dementia. So we just went over 8 ways to be brain healthy, and we're really talking about that in terms of, I think, on how to live a healthy lifestyle, and maybe how do I reduce my risk of developing dementia. So dementia is an umbrella term. It encompasses different, as you can see under the umbrella, different types of dementias. So we have Alzheimer's disease, which is a type of dementia. We have dementia with Lewy bodies, vascular dementia, frontal temporal dementia, Parkinson's disease type dementia. There are and mixed dementia. There are literally a number of different types of dementia under the umbrella term. It really is dementia when it affects your memory, your thinking, your behavior, and it affects your ability to engage in activities of daily living independently. In terms of dementia, there is no one size fits all. So if I develop dementia, it would be completely different than if Mark developed dementia. And if we both had Alzheimer's disease as well, every journey is different. And every journey is different, and the symptoms differ. Although the pathways are very similar, everyone experiences it very differently. And not only does the individual living with dementia experience it differently, but so does the person that supports them as a caregiver. So dementia can affect our memory, our thinking, judgment, learning, so the ability to learn new skills, listening and speaking, orientation, knowing where you are, what day of the week it is, and overall understanding. It makes sense in terms of, if you can't understand the words that I'm saying, and you don't know where you are, then you won't be able to understand what I'm trying to come across. And my explanation there was very confusing. However, I'll just stop there. But as you can see, dementia, I would say, is more than just memory loss. And I think that's the biggest misconception that the public has, is that dementia is simply just memory loss, but it's more than that. And the other big misconception is dementia is not normal aging. So age, yes, it is a risk factor. Every 5 years over the age of 65, your risk of dementia doubles, but dementia is not part of normal aging. It is a syndrome that so it is not part of normal aging. So really the message we're trying to say here is that if you do notice someone who is having memory problems, has some behavior changes, or is having difficulty following instructions or learning, then it is an encouragement to go to your family physician and to get assessed. Just because someone is 85 doesn't mean it's okay to have some of these warning signs. And speaking of warning signs, we do have 10 of them here. And again, it would be, it's on your handout as well, but really these warning signs are to help either acknowledge in yourself some things that you may be realizing, although insight is decreased with brain changes. And so I guess it would be more identifying some of these things in your family or friends or neighbors or colleagues. So memory loss that affects day-to-day activities, challenges with performing familiar tasks. So it's normal to forget an ingredient when you're baking a cake for your wife, Mark, but it's not normal to not know how to follow the instructions altogether. We talk about confusion about time and space. So it's okay to, wake up and not remember what day of the week it is, but you do remember. It's a warning sign if you're not familiar of where you are at the grocery store and why you're there. Challenges with language, we already spoke about this, but it challenges with verbal expression or reception of language, or mixing up words and not using the appropriate word to describe maybe something that's going on. Oh, it looks like we may have a question. Oh, no. Challenges with abstract thinking. So my example is a little bit old school, but it's balancing a checkbook. So it's okay knowing, maybe pulling out the calculator because you don't know a simple addition or subtraction or multiplication, but it would be a warning sign if the numbers don't make sense altogether. Misplacing items, we all do this. Last night, I'll tell a story that I lost my keys at work, and I actually had to call a locksmith to open up my car to let me in with. Luckily, I had an extra set of keys in my car, but I simply misplaced my keys. I think they're in the garbage, and the housekeeping did clean them. So that being said, if I was to do that a couple times in a month, that would be a warning sign. Changes in mood or behavior, changes in judgment. So this winter, a warning sign would be, wanting to go out to the grocery store in shorts and a t-shirt. I would say one of the biggest warning signs is apathy or a loss of initiative. Someone who is more engaged in their community, going to events or with their family, now more isolating themselves at home, not wanting to participate in previously loved activities. And changes to personality. So these are all warning signs. And again, I can guarantee that we all can associate with each one of these warning signs, even though we have a healthy brain. So it's not about forgetting, but it's about being able to remember. And it's the difference between from time to time and consistently. Oh, I'm trying to. So really, it's important here that if you do notice any of these warning signs, or if you in yourself or a family member or a friend or a colleague, it's really to have that courageous conversation, to talk to them of what you're seeing, and to encourage to go talk to a physician, talk to your family doctor to get assessed, because it may not be dementia, and it may be ruling out other things like depression or delirium. But if it is dementia, research shows that the earlier on you're assessed and supported, the better supported you are, and the better your journey, and not only for you but also for your family and your and the person who is supporting you.
Question?
Yes.
Is it common for one form of dementia to progress to another? For example, Alzheimer's to vascular?
No, that's a very good question. And so if I scroll back to this umbrella slide here,
Mm-hmm.
I'm just trying to move. There we go. You see at the bottom we have what is called mixed dementia, and mixed dementia is, I think, almost becoming one of the most prevalent types of dementias. It's because often Alzheimer's disease is mixed together with vascular dementia. So I wouldn't necessarily call it progressing towards, but I would say it is more that they're occurring together. Does that make sense?
Yeah, thank you. Yes, it does.
Okay.
And Dean, do people tend to have a good reaction when they go to their family doctor and sort of say they're struggling with some of these warning signs and that they're worried they might have dementia?
That's a good question. My experience would be that people's reaction does vary. It is a very difficult thing to hear, that or to receive a diagnosis of dementia. But at the Dementia Society, we're part of many memory clinics where people are assessed and they are supported in terms of having a dementia care coach there, and social work for support, and knowing what are the next steps of the journey. So I would say that, I mean, everyone's reaction will be a little bit different, and it is a very difficult piece of information to hear, and that your life, almost doesn't change, but does change. But there is lots of support available.
Yeah. So people shouldn't be scared of a reaction or a diagnosis, but actually go and get help and then get the support that they need.
No, you're right. So thank you for leading me towards that. It shouldn't be scared. As I said, that the more research is showing that the more informed and the earlier you are connected and supported, the better you're able to cope along the journey. So really encouraging people to go to your physician and get assessed if you do have some concerns.
If one of your family, like your mother, has dementia, and are you more prone to have dementia?
That's a great question. So there is a very small percentage of dementia that is genetic. Very, very small, and it is more towards the frontal temporal dementia, and a little bit of Alzheimer's disease. So it depends on which type of dementia. Although, if someone in your family does have dementia, it would just be we would encourage you to monitor and to stay close with your physician for assessments, and to follow the 8 ways to be brain healthy. But in terms of genetics, it's a very, very small percentage. I don't have it in front of me, I apologize. But if you do put your information in the chat box, I could send you stuff as a follow-up.
But if your mother and father have had Parkinson's disease, Alzheimer, Alzheimer. So are you more prone again, your father and mother?
Again, it would depend on the type. So the type of Alzheimer's, and what I'm trying to say is that right now the only way to know the type is actually an autopsy after death. And so there is a small percentage of dementia that is that there is a genetic component to it. So I can't tell you if you have an increased chance. I would just because it depends on the type of dementia.
Would Parkinson's disease dementia be one of the ones that was more hereditary because of Parkinson's?
You know what? I don't know off the top of my head, so I don't want to give an answer to that is wrong.
I think I've just added to the chat box a link from the UK Alzheimer's Society that has a web page on that question. So if you're interested, that appears to be a site you may want to have a look at. Thanks.
Perfect. Thanks, Mark. So really, just to summarize around the brain healthy choices, it's really encouraging you to focus on ways to be brain healthy, to pick one or all 8 of them. That our brain does age like the rest of our body, and there is some slowing down in terms of memory, concentration, and speed of thinking. However, dementia is not a normal part of aging. And so really to look at those 10 warning signs, and if you see any changes in yourself or a family member or a friend, to go to your doctor and to look to see if it is to rule it out and to start that process of being supported. So the next part of the presentation, I really just wanted to focus on the caregiver experience. So at the Dementia Society of Ottawa and Renfrew County, we're a non-for-profit that supports caregivers and persons living with dementia. We are here, and really the focus here is that I'm sorry, I just have to pause here for a second. There was just someone at my door. I'm sorry. Sorry about that.
I'm going to take this opportunity. I sent out a private chat to everyone. I'm just asking you to confirm your email addresses. Please send those to me so I can enter you into the draw that we are doing at the end of the webinar. Thank you.
So thank you, and sorry for that pause, but great Phil. So at the Dementia Society, we're really here to help support caregivers of persons living with dementia in terms of providing support, information, system navigation, and I'll go over at the end of the slide deck some of our programs and services. But really wanted to highlight here some pretty amazing stats here that come out of CAI, but there's also a spotlight on caregiver that recently came out. But it's pretty amazing here that 26 is the average number of hours informal care is provided to seniors with dementia, compared to 17 hours for other seniors. 45% of unpaid caregivers, 45% unpaid caregivers of seniors with dementia are more likely to experience distress than caregivers of other seniors. So that, that's why we're here. That's at the Dementia Society. That's why we're here. That's the support we're here to provide. Help to decrease the caregiver distress or burden by equipping equipping by informing you, giving you the information that you need to and the navigation and the support along the journey. Caregivers of seniors with dementia have a higher odds of reporting distress if the person receiving care displays verbal or physical aggression. And so this is really saying in part of dementia, there is what we call behavioral or psychological symptoms of dementia. And so if these behaviors start to occur, it just adds to that distress. And if we really wanted to change our government here, we would just tell all caregivers in Canada to go on strike, because we save $1.4 billion of healthcare costs. So it's estimated that total out-of-pocket costs paid for caregivers of people living with dementia.
Heidi, just a question from a person on the webinar. Are these the total costs, or would they include sort of administrative costs or office costs, or the coordination of the care, or just the actual wages paid to the caregiver?
That is a great question. So if you look on the bottom here, there is a link to CAI where these stats were pulled. I can't tell you exactly from how the costs were totaled, but it would be similar to what you had just said, Mark, but I can't tell you specifically.
I imagine that it's probably difficult to get very precise data, given that it's a big population sample, but it's probably a bit of estimation involved.
Yeah.
I'm not sure, but I imagine.
So as a caregiver, whether you're caregiving for someone living with dementia or something else, caregivers play multiple roles. You're a care coordinator. Your job is really to identify, arrange, call specialists, have follow-ups with appointments, schedule appointments. You're a recreational coordinator. So looking at how can we, what activities can we engage in? How do we follow our ways to be brain healthy? You're an advocate. You're a nurse. You're a psychologist. You're the housekeeper. You're the property manager. You're the accountant. It's really, caregivers play an enormous role, and it can be overwhelming at times. And so really, again, it's how can you build that resilience in order to be able to continue to maintain these roles. So as a caregiver, we're looking at what are the goals, and it's looking at goals to reduce suffering of the person living with dementia. And I don't, and so it's really to look at how we can help maintain people to live well longer. It's to prevent further health problems. So not only is, if we look at dementia, people often have other comorbidities. Taking their medication for diabetes or other heart conditions. It's really to avoid visits to the emergency department or unnecessary hospital admissions. And it's to keep our loved ones at home as long as possible, if that is what you wish. But really, the picture I'm trying to paint is that being a caregiver is very stressful. There's lots that you have to focus on, and often you feel very isolated. And so we're not the only support out there, but the Dementia Society, we're here to help make this journey a little bit easier and to ensure that no one faces dementia alone. So when we talk about resilience from the mental health perspective, but also from a caregiver perspective, it's really the ability to adapt to stress, and to really bounce back to a previous state or even bounce forward. by incorporating the new experiences and to bounce forward to becoming more so that you can. Sorry, I can't see the bottom here. But it's really looking at to bounce forward and incorporating the new experiences. And so, how do you build caregiver resilience? Well, you could look at it from different boxes or spheres. And so you could look at building your emotional resilience or self-care, looking at spiritual self-care, psychological self-care, social self-care, or physical self-care. And these, spheres of self-care is where you can go to when you're feeling that burnt out or that distress. Is that you I'll quote, is that where you draw that magic bath and you have that relaxation time at home? Or is it where you go to your spiritual community for support? Or is it that you take that long run that really helps clear your mind and to build some resilience? But it's all about recharging that battery that you have so that you can continue on.
And Dean, on that, I know for a lot of caregivers, it can be very difficult for them to prioritize themselves, and also quite difficult to leave their loved one on their own. So do you have any tips on that as well?
Yeah. What you're talking about is finding some respite. So respite, whether that is having support from a family or a friend, that they could be with the person living with dementia as you go engage in another activity or find some engage in some of these self-care activities, or it is looking at paid respite, or there's adult day programs that can be not only beneficial for you as a caregiver, but for the person living with dementia as well, in terms of a social activity, a physical activity. So it is challenging because you're juggling so many items, but you make a very significant point in that it's important to take care of yourself in order to take care of someone else. It's like that airplane, it's like being on the airplane and where you're supposed to put the oxygen mask on yourself before you put it on the person beside you.
Because at the end of the day, if you burn out, you're not going to be able to care.
Yeah, absolutely. And so, or it's looking at, sometimes people find respite in doing activities together. So maybe it is going to an exercise program together, and where there is support for the person living with dementia, but you're able to engage, and you don't have, and you're able to engage in your own way. But it's really recognizing how you, what is the way that you are able to recharge your batteries and build your resilience. Oh, yep. So as I explained a little bit at the beginning, so at the Dementia Society, we're a non-for-profit that really has been around for quite some time, established in 1980. We support Ottawa and Renfrew County. We do have some funding from the local health integration network, which is the government, but a lot of our support does come from donations. I would say that we have one of the most memorable visions for an organization that I've ever participated with, and it's really that we're here to help ensure that no one should face dementia alone. So how do we do that? How are we there to help? Well, we have a team of dementia care coaches. So a dementia care coach really is that your go-to person. They are there to provide information, system navigation. The healthcare system that we've created is pretty complex, and so they really know the support, whether you're looking to how to get a diagnosis or how to get assessed, or what community resources are out there. And really, they're your go-to person for helping you with strategies for self-management. So really, what tools can you put in your toolbox so that you can be independent as possible? So we have 10 dementia care coaches in our Ottawa office that we work out of the Pearly Rideau Veterans Health Center. And we have 2 dementia care coaches that help serve Renfrew County that work out of Arnprior. Our support that we provide is one-on-one, and it's for caregivers, it's for persons with dementia, or even the entire family.
And I thought, Dean, and I could be mistaken, when I was on the website, people can self-refer. Is that correct?
That is absolutely correct. Where you could fill in a request for help online, or you could just give us a call. From 8:30 a.m. till 8 p.m. Monday through Thursday, there's a dementia care coach available to support you. Oftentimes, when you get connected with a dementia care coach, they're your go-to person along the entire journey. And so some people are there, and if they'll call us for support in terms of if they just have a question, or if they need someone to talk to, or they're not sure what are the next steps that they can do. Mm-hmm. I think 2 questions popped up. I don't know if, Mark, I don't know if you had, here, I'll just check. Oh,
I think they're
Mark's just sharing. Okay, perfect. So as I'd mentioned, so when do we say care partners or caregivers and families need help? We're really at the point of first diagnosis. I've mentioned this multiple times, but the more connected you are, the more informed you are, the better the outcomes. Or even during points of change, when there are physiological and behavioral, psychological and behavioral symptoms. So we're here to help teach caregivers how to figure out what are those unmet needs that are causing those behaviors. When function is declining, or really at any point of the journey. I used to work as an occupational therapist in an acute care hospital out of Toronto, and I worked with many persons living with dementia to help get them as they came into the hospital, to help them return their function in order to be safely discharged home. This is my big pitch moving into the community and into the Dementia Society. But as an occupational therapist, I never once connected the caregiver to an Alzheimer's Society or the Dementia Society. And I really think that now, being on this side of in healthcare in the community sector, I really think that if I had connected caregivers to the support that the Dementia Society provides, I really think we would have prevented many hospital readmissions. I think that caregivers would have been less burnt out that I worked with, and I think they would have been more informed. So in general, as I explained, how a dementia care coach can help. So really, when family members or you as a care partner are struggling to cope, we're here to help you find the appropriate support. If you have questions and you can't find the answers, we'll figure it out. We have connections to the best physicians in Ottawa through the Briere Memory Program or the Regional Geriatric Program. I often like to joke and say that we know the answers locally better than Google. So it'd be faster and quicker to call us for support. And when you really want to develop the skills or techniques to stay connected to the person living with dementia. Because as the disease progresses, the ability to communicate and to maintain independence does change. So how can you maintain that connection? And we're really there to help teach that or support that. So mentioned throughout the presentation briefly, but we do have many different education programs to help get you up to speed. You know, just really, if you're interested in learning more about dementia, give us a call or fill out a request for help, and we'll help figure out what is the best education program or session for you. Support groups. We have support groups that are co-facilitated by a dementia care coach and a volunteer with lived experience all over Ottawa. For those of you who are tech savvy and enjoying this, we do have one online through Zoom. So again, you could join through the comfort of your home. And we do have social and recreational programs. Just mentioning the benefits of being social, physical activity. So we have an exercise program, a music program. We also do have a great partnership with the National Art Gallery and guided tours for persons living with dementia and caregivers. But really the important thing is really to connect with us, and we'll help figure out what is the best, which you know, education support group or social program is best to fit your needs. I know that it's part of the information that you're provided, but if you do want to reach out, our number is right there. An email is simply info@dsorg.org, or you can go to our website and all the information is there as well.
And this will be information that we'll also add to a partnership tab, I think, on our website as well. I think is something that Helen and I discussed.
Yeah, so you'll be able to access this, and we'll also email you the links that Mark was sending around as well, following this webinar, so you have access to them.
Yep, in the same email that I send out announcing the winner for the gift card, I will send out all the resources and all the information. And again, keep an eye on our Facebook page for when the video becomes available. Sorry, I had a question come in from someone. Dean, I'm going to direct that to you.
Sure.
Are there any supplements that we could all be taking to maintain mental health, like brain health?
That is a great question, and I'm going to direct that question to your physician. But really, in general, encouraging you to follow the Canada's Food Guide. There is research, if you Google, there's information out there about many different things. And so just to be careful not to follow too much into the craze, but really to go to your family physician for more information.
A question. I have a question.
Sure.
I have a question. When a person has dementia for many years, you know, is it better to put the person, older person, in an institution for many years, or to keep the person at home?
I think that's a great... Go ahead.
That's it.
Oh, that's a great... Sorry to cut you off.
Go ahead.
When a person has dementia, an older person has dementia for many years, is it better to put the person in an institution or to stay with the person all the time, you know?
That's a great question. So I think that is a decision that is uniquely made to each group. And so it would be dependent on what are the wishes of that person living with dementia. And What we like to encourage in that if people are connected with us earlier on is what we call advanced care planning. So what are your wishes? And some people really want to be in a care facility where they're supported. And some people really want to live at home as long as possible. Both options, I wouldn't say one is better than the other. Really, you just want to make sure that you're safe and that you're supported. And so to answer your question, it really depends on the individual who is living with dementia and the person or people that are supporting that person.
I also want to take a moment just to chime in there as well, Dean, if you don't mind, just because that is a very important question and it's not something that's often addressed. Coming from an RN psychotherapy perspective, caregiver guilt is a huge thing that is out in the community. Adult children are feeling like it is their responsibility to make all these decisions for mom, dad, or a loved one. But it's important to know that there is no right or wrong answer to that. So if you feel like them staying at home is what's best, that is what's best for your family. If you feel like them going to a home is what's best, that is what's best for your family. There is no right or wrong answer. It is entirely situational dependent. As we said earlier, you can't pour from an empty cup, and there's no shame in asking for help if you need it. So just keep that in mind when you are faced with making those difficult decisions, because people don't reach out for help often enough. So thank you for asking that. It is very important to touch on. That is my add-on to that.
Thank you.
I'll also do a plug there. Actually, Jess wrote an excellent blog post on caregiver guilt. So if you are a caregiver and you've been feeling any feelings of guilt, or you know someone who has, do check it out. It's on the blog site on our website.
Amazing. Happy to answer any questions. I just wanted to say that the presentation on brain health, so the first part, the 8 ways to be brain healthy, was made in collaboration with Ottawa Public Health, and they have lots of information on their website. And that really, as I'd mentioned, the Dementia Society, we're here to help support whether you are a person living with dementia or you're a caregiver. We have a team of staff who can support you by providing information, support, and system navigation. We're also a non-for-profit, and so if you are looking for opportunities to engage, or if you know someone, have them reach out. We're happy for more volunteers or support for our organization.
Or perhaps even financial contributions, being a charity, that probably doesn't hurt either. So, yeah.
So that concludes the brain health presentation and the small bit on caregiver support and being a caregiver. I hope it was informative. I know that there's some questions here, so we can get some feedback and yeah. Thank you.
Dean, I want to say, yeah, many thanks for taking the time and volunteering your evening and giving that up on a lovely sunsetting warm day. And thank you to everyone who attended as well. I hope that this has been valuable and has given you some things to think about, things to try, a different perspective, knowledge of where to get more information, knowing that the Dementia Society, bunch of friendly people. When I was there at the office today, I was most impressed, and I know they're there to help and to make things as easy as they can be if you're faced with this challenge in life. So again, we really appreciate it. Dean, everyone else as well, many thanks. Questions, feel free to type, to ask Dean, contact us, do so offline, online, as you wish. I'll turn off the recording now, if I may.
I'd like to add, if I could.
Please.
We found that the presentation would be very informative, and certainly it was great to have the opportunity to participate and not to have to get in our car and drive across town. We found it very Very helpful.
Wonderful feedback. Thank you.
Thank you.
No,